All right, James Dibben here with Confessions of a Hospice Nurse.net and the Hospice Nursing Podcast. And here are just some tips and tricks on how to use the clinical data sheet for admissions. So as you can see, we can put the patient name right here, who is going to be John Doe. All right, so we can put now and 3 months and 6 months and 1 year if you want. Okay? Maybe that looks funny being MON. So the PPS right now, when you talk to them, maybe it's 40% because they're almost always in bed and just get up a couple times a day or whatever. And then 3 months ago, maybe they were 50%. And 6 months ago, they were maybe 60%, or maybe a year ago, they were driving. Okay. And what do they weigh now? And you might be able to get that from hospital records. So maybe they weigh 116 pounds right now, but 3 months ago, or maybe you'd be more likely to know 6 months ago, when they were maybe more ambulatory or could balance better, they were 140. Because as we know, a lot of times when we get patients, they can't really stand on a scale anymore. You're not going to be able to get an old Mac, but right now maybe the Mac's 22, so you've got that documented. And then you can talk to them about sleep and how many hours of sleep. They're sleeping 12 hours at night, and maybe they take naps during the day. And 3 months ago, they were only sleeping 8 hours at night. And anyway, you could just work your way down and find out, well, have they fallen recently? Well, yeah, back during the summer, they fell once. And then you could talk to them about oxygen flow. Maybe they're on 2 liters now. And 6 months ago, 3 months ago, they were still on 2 liters. But then 6 months ago, they weren't on oxygen at all. And you just work your way down on this. And this is more for recertifications. I don't usually mess with folks on that unless they have some detailed information. Then talk to them about infections. Have they had any infections recently? And maybe their last hospital stay they did. Maybe they were in for pneumonia. And have they had medication changes? This is kind of a big deal. Maybe, a couple months ago, we had to DC the metoprolol because she was becoming too hypotensive. So we were having some hypotension, and now no BP meds. Okay, and then what's the food intake like? 2 meals a day? Maybe they were eating full meals, 3 meals a while back. See how so much more, you get way more information from families than you necessarily will get out of medical records. So let's erase that. So what are they able to walk? Maybe they use a walker now. And 3 months ago, a cane. And 6 months ago, nothing. And then pulse, respirations, blood pressure, that just kind of depends. Edema, we're at 2+ now, and we have 2+ then, but 6 months ago, it was just trace. So hospital, ER visits, well, we're just coming out of the hospital for 6 days. And then, but 6 months ago, we were in for a CHF exacerbation. And then how alert and oriented they are. Maybe they're fine now. Verbalization. Now living with family. But 3 months ago, living at home. That's a big change, right? Some of this stuff is more for recertification, but do they get shortness of air with exertion? Yes. Yes. And then maybe no. Not very often. And then their daily activities, do they have any wounds? And you just work your way down on this thing, pain level. When you are done, now you can call your doctor to discuss this patient and see if they qualify for hospice, and you have all this information you can give him because you've marked it all out and you've tracked it all, and your admission note narrative is complete. You can go down through here and say that 6 months ago he was 60% PPS, and 6 months ago he weighed 140 pounds. 6 months ago was sleeping 8 hours at night, now sleeping 12, and 6 months ago not on oxygen. And you just work your way completely down the list, talking to the doctor, and the doctor's like, yeah, this patient's changed a lot in the last 6 months. And so we do think that they qualify now. So there you go. That is how to use the clinical data sheet for an admission. If you have any questions, just email me at james@confessionsofahospicenurse.net, and I will answer anything, or you can comment right here. Talk to you later. Bye.